whole project. We will not take questions during the presentation, but if you have a question or a comment, please put it in the chat, and our coordinator of the questions will present them at the end of the presentation. After this presentation, tomorrow or the next day, you will receive a resource page and a video of the presentation, as well as slides that the presenters have put together. So you will have that to follow up on everything. One of the issues that we're going to be really presenting tonight is to look at exactly what Project 2025 is. Just so you know, there are 922 pages of the whole project. So you know that they can't present it all this evening. So they're just going to present a minor part of it so that they can get your interest arisen so that they can look at it again. And just a couple of things we want to point out, that the whole Project 25, many people think it's just for, if there were to be a Trump presidency, it would be for that. It is not. The Project 2025 is a whole project of policy recommendations. So it doesn't matter who we have or what we have for president next time. And the other thing is that many people think it's strictly a USA kind of a policy recommendations, but it isn't. It's a whole global plan that the far right wing would like to have going. So let me now present our two presenters, Elizabeth Sommers and Christiania Sulkit. As I mentioned before, both of them are wonderful public health practitioners. They're also activists and advocates for public health. So Elizabeth and Chris, I present you to our audience, and you take it from here.
Thank you so much, Catherine. It's really exciting to be with you all tonight, because we know that folks who check into the Mass Peace Action informational network are really interested not only in developing what they know, but then transforming that into action. So it's great to be here, and to be with Chris is always a delight. We decided that instead of kind of being talking heads and just, going from, I'll do half and you do half, that we would really try to get more of an ongoing conversation together. So that's what we'll be endeavoring to do. We do have some slides that will serve as kind of a guidepost for us, and I'm just going to see if I can get those right now. Let's see.
And just to add, so Dr. Beth Sommers made these slides, so I can take no credit for how great they are. But a lot of it is really just to show you that we didn't create this information that we're sharing. She has it up and in quotes and in bold, so you can see that what we're telling you about it exists right there in Project 2025. And we couldn't have thought up of these ideas if we tried.
We first started hearing about it probably 2-3 months ago. And some organizations, some of the veterans groups, some of the occupational safety and health groups were the ones who started focusing on specific nuggets of information. As Catherine mentioned, this document is 922 pages, and probably every single page has 4 to 5 recommendations that any of us on this webinar tonight would find completely objectionable. So we wanted to focus in from a public health perspective, what our concerns were, and potentially give folks talking points so that when they're, with their colleagues, with their networks, with their families, they can say, oh, do you know that Project 2025 has such and such an outcome for children, or for your sons or your daughters, or your veteran in your family. So as we go through this, we'll actually give you a few of those examples. But I think one of our favorite things to talk about is that public health is really something way beyond vaccines, way beyond medical care. It's really looking at health justice, peace, justice, the environment, and all of these factors around us that influence our health. And Chris may have a bit more to share with us about this before we go on.
So I like you all hopefully all realize that everything is public health. It's health in all policies, it's health everywhere. So that way we realize and understand, for example, that transportation also affects our health, whether you have access to it, can you get to work, for your job, to doctor's appointments, education, can your children go to school and have a safe environment? All these different things are all part of public health. The environment, of course, is public health. Where you live, do you have idling buses spewing, terrible fossil fuels outside your window? Do you have access to green space? So all of that is public health. And so in so many ways, these 922 pages are all about public health. Of course, we don't have time nor energy in this moment to share with you. But just know that when you look and you read, if you want to go through it, but when you talk to people, recognize that all these different aspects are all about health, justice, the environment, and that it has ramifications for everyone, from the environment to the individual, but really to the community at large, both here, where we sit maybe in Massachusetts or elsewhere, but all across the globe.
This is a quick overview. It was developed by the Conservative Heritage Foundation as a mandate for leadership. So it's like a script or playbook, particularly meant for a Republican U.S. president who would be elected imminently, and this would be his first 180 days in office. Each chapter is addressed to a specific part of the government. And so on the right-hand column there, all the various departments of the government will have specific recommendations for them. The authors of Project 2025, each chapter has several authors, and there are many overlapping themes that we'll get to in a minute. But when we did this talk the first time, Chris pointed out, there's no Supreme Court on there. And she made the point that, well, the Supreme Court right now is set where it's going. Just an overall kind of bird's eye view, it envisions an extremist right-wing policy on every aspect of our lives. It defines marriage as a union of one man and one woman, denies government support for transgender individuals, dismantles protections for the LGBTQ community, supports very xenophobic and racist immigration policies, eradicates environmental protection policies, deregulating water and air quality, and weakens protections for workers' safety. One of the particularly, ways that people think about public health is during things like COVID, with mask mandates or what kinds of vaccines. Well, in the next pandemic, masks will be outlawed, and light as a medical intervention will be focused on instead of vaccines. For many of you who have worked in the cause of peace, Project 2025 really fortifies the military-industrial complex, weaponizing space, increased nuclear capacity, and we're going to go over the specifics about this in a minute. And one of the really chilling aspects of Project 2025 for our Indian populations, and this is quoting them, recommends consolidating all tribal entities into one unit and relocating them all somewhere out west. Now, this sounds a lot like a concentration camp. We will just say that. And Project 2025 would also reject free school meals for children. Chris, anything else you want to add
Yeah,
on any of
so
these?
so there's so much in here and it's really rich, and we have extra slides that kind of delve and dive deeper into all of that. But I guess what I also, and we'll try to underscore again later, is that all of these elements are elements that are written in here largely by about 140 members of Trump's first term, his cabinet, his appointees, his staffers. And so something just to make it known is this is concerning because an earlier version of this was done in 2017 by the Heritage Foundation, and it laid out all of a number of recommendations. And if you look at Trump's term, he implemented 64% of those recommendations in this earlier version of Project 2025. So while candidates or someone may disavow it and say they don't know something exists, I would caution you to look back at history, look at the evidence, be evidence informed here. And also just know that this is just one of 4 parts that the Heritage Foundation has put together with regards to how they are ready to hit the ground running as soon as they have their very conservative candidate in office, if it happens. Thank you.
And just a couple more of the kind of big highlights. Spotlighting the sanctity of human life, and which happens in many chapters, beginning at conception and ending at natural death. We give you the page numbers of the references of all the things that we're going to be discussing tonight. Project 2025 does not mention a thing about gun violence, another epidemic, and health and safety of workers. The only reference I could find was that there's some dangerous jobs that you need small bodies to do. So that might be in mining or might be in construction. And Project 2025 would allow young people to engage in these dangerous fields with their parents' written permission. And that's how workers' health is getting tossed out the window. So quite sobering. What we're going to do for the rest of the talk here is give you some of the direct quotes from Project 2025. And again, what we've done is italicized the content, giving you the page numbers. And we will start in honor and deference of mass peace action tonight, recommendations about peace and militarism. And this quote from Dwight Eisenhower, "Beware the military-industrial complex." You will see some staggering recommendations. So again, these different chapters kind of come together, and these are recommendations to the U.S. Department of Energy, the Department of the Interior, and the Defense Department. Big recommendations: develop new warheads in every branch of land, sea, and air defensiveness. Reject the ratification of the Comprehensive Treaty and indicate a willingness to conduct nuclear testing. The mission statement for a reformed Department of Energy: develop new nuclear weapons and naval nuclear reactors. So this is an example. If you have friends anti-nuclear for whatever reason, but they don't really know much about Project 2022 or 2025, or they don't recognize that there's a connection with kind of far-right forces here, you could get into a conversation with them. How do you, I know that you're against nuclear energy and nuclear weapons. Do you know that Project 2025 is really promoting this on every level? And in fact, the first priority suggested in these revamped policies is reestablish a culture that promotes a war-fighting focus, maximum effectiveness, and border security. is, we know that's a big issue for this up and coming election. And that border protection will again be intensified and make use of U.S. military. Chris, anything you want to add right in here?
So just to add, and I think I also see people having like a great discussion in the chat amongst themselves, which I really appreciate. So one thing I want to hit upon is, if you find a candidate who doesn't want to implement it, that's great. But I guess the reality is we have a conservative candidate and that's who we have right now, right? And so that's why we looked at it the way we did, and we wanted to call and bring it out. And she's going to, or Beth, I think the next set of slides will show it soon, but to recognize that as they emphasize an interest and an urgency towards war fighting, border patrol, nuclear weapons, on the flip side of that is getting rid of a number of environmental protections and regulations that are in place, which, as we literally have seen with 2 very recent hurricanes, the effect on the environment and all of this shift in focus towards nuclear, maybe away from the climate, is truly dangerous for, folks and the environment. It's something to really be concerned about. When someone's talking about their priorities, you can also realize what they're not prioritizing.
Yeah, here we go on page 94. Implement nuclear modernization and expansion. Needed reforms, prioritize nuclear modernization and restore the nuclear infrastructure. Strengthen America's defense industry. Here's where our military industrial complex comes into effect again. Replenish and maintain U.S. stockpiles of ammunition and other equipment. This will strengthen the defense industry supply chain. Collaborate with industry to develop a prioritized list of reforms that the Department of Defense and Congress can enact and implement to incentivize industry. Very clear about all that. For those of you who might have children or grandchildren or nieces and nephews in school, Project 2025 encourages improving military recruiters' access to secondary schools and students, and actually require completion of a vocational aptitude test that is the military entrance examination. So any school that receives federal funding is going to have routine visits by the military with the aim of recruitment. And even members of Congress have been put on notice that they should provide time to military recruiters during each town hall in their congressional districts. Junior ROTC, which is the Reserve Officer Training Program in secondary schools, will be increased as well. Reinstate service members to active duty who were discharged for not receiving their COVID vaccine, restore their rank, and provide back pay. Next recommendation there, eliminate Marxist indoctrination and divisive critical race theory programs, abolish newly established diversity, equity, and inclusion offices and staff. This is a message that rings through almost in every single chapter of Project 2025. I don't know why I'm going backwards here. They are very concerned about Marxist indoctrination, and they never say exactly what that means. So it's kind of this nebulous term, but we know Kamala Harris has been called a Marxist. And anything that has to do with diversity, equity, and inclusion is going to be eliminated if these various policies get promoted. Reverse policies that allow transgender individuals to serve in the military, gender dysphoria is incompatible with the demands of military service and the use of public monies for transgender surgeries or to facilitate abortion. So here's a whole other topic that just gets put in here. I tell you, as an academic, if I were reading many of these chapters as a term paper, there would be some severe debits taken off in terms of talking about something totally out of context, not providing any resources or references about it. And this was certainly one of those. Last recommendation on this page, audit all curricula and health policies in the Department of Defense School for Military Families, remove all inappropriate materials, and reverse inappropriate policies. So all of this inappropriate has to do with DEI and anything that is, just determined to be of Marxist lineage. Chris, you want to say anything as before we go to the Department of Energy?
No, keep going.
Okay, sure. So now the next set of recommendations comes from the chapter on reforming the Department of Energy. And once again, there is a high emphasis on developing new nuclear weapons and naval nuclear reactors. So this is going to be segue into the environment here. And here we have unleash private sector energy innovation by ending government interference. Stop the war on oil and natural gas. I tell you, we couldn't have come up with plans or ideas like this. This is really the words of Project 2025 itself. Allow individuals, families, and business to use the energy resources they want, and this will best serve their needs. A big underlying emphasis throughout this document is deregulation and privatizing. So, we know for all of us here in Massachusetts, what we've just gone through with the Steward hospital systems and in terms of privatizing. And when we privatize agencies, we lose the capacity to know what they're doing and to have any kind of input about them. So Project 2025 is definitely a document that supports deregulation and really emphasizes the importance of privatization. The next administration should stop using energy policy to advance politicized social agendas. Programs that might sound innocuous, such as energy justice, 9 Justice, 4010, and DEI, can be transformed to promote politicized agendas. This 9 Justice 40 is a government program that ensures resources for communities that are economically challenged so that they can have things like clean water, clean air. Are these always enforced? They need to be, but if Project 2025 has its way, these will not be continued at all. And the focus on climate change and green energy. Eliminate energy efficiency, standards for appliances, eliminate the Clean Energy Corps. You can see, again, for your networks and your colleagues who, are very clear about environmental change and degradation and the need to act for climate change. If they're not aware of this, knowing some of these particulars that are being recommended can get them activated as well. And, as Catherine was saying earlier, Project 2025 is not just kind of limited in time and space. Even if a Republican is not elected to the White House in the upcoming election, all of these recommendations are not going to just disappear and evaporate. They will be continually worked on and toward. Defend American interests in the Arctic Circle. I know many of you have been involved with, pipeline questions and not wanting energy to be moved in through pipelines and destroy natural environments. Project 2025 is going to drill in the Arctic Circle. Restart Yucca Mountain licensing. Yucca Mountain is a sacred place to many native groups in the United States. Yucca Mountain will become a nuclear dump if Project 2025 passes. So something to share with your friends and get motivated to write about it and think about it and transform this. Remove the GEAT. And day one priorities: suspend and review the activities of the EPA, the Environmental Protection Agency, advisory bodies. So goodbye to the EPA. All of these recommendations are to the U.S. Department of Energy, the Environmental Protection Agency, and the Department of the Interior. Chris, anything else you want to underscore before we go? Okay.
I guess I will want to add something that you had said quickly, like, regardless of if you have a president that comes in who is supportive of this, I think the other thing I need to just make sure we call out is this work is already happening. This playbook of 922 pages is already out there, and it's actually one of 4 parts that the Heritage Foundation has put forth. They already have a database of folks who will support these recommendations that they're putting together. They are working on that. They even got funding to put together from Oracle. They have tutorials and webinars, sort of like ours, but teaching folks how to put forth these recommendations at your local, state, and national level. And then something else to really note is we need to be not just ready to vote in this upcoming presidential election, but in all of our elections, in our very local elections at our town, city, and our state levels, because of that pipeline of where folks who are supportive of Project 2025 are doing really good at is they have folks at the local level who are already believing in all of this and are already censoring or who are already banning books in your schools, in your school libraries, in your community libraries. So I guess I just wanted to say, like, while this might seem really big picture, it's not. It's big picture with very individual, hyper local ramifications for folks. And you'll see it as we as we delve into the recommendations for health and healthcare.
Yeah, thank you. Thank you. So these are some recommendations for the U.S. Department of Health and Human Services. First goal: protect life, conscience, and bodily integrity. The Secretary should pursue a robust agenda to protect the fundamental right to life. There's a little phrase there: protect conscience rights and uphold bodily integrity, rooted in biological realities, not ideology. The Secretary must ensure that all health and human service programs and activities are rooted in a deep respect for innocent human life from day one until natural death. Abortion and euthanasia are not health care. Makes that clear. Goal number 4, preparing for the next health emergency. Unaccountable bureaucrats like Anthony Fauci should never again have such broad, unchecked power to issue health guidelines that will certainly be the basis for federal and state mandates. Project 2025 definitely gets a lot of digs into various individuals who they are critical of, and Anthony Fauci gets more than his share of criticism. The only way to restore public health, or to restore public trust in health and human services and as an institution capable of acting responsibly during a health emergency, is through the best of disinfectants, light. Now, I swear I did not take any words out. I did not add any words. This is the direct quote. So how does anyone know that the best of disinfectants is light? We don't know, but it's on page 4 52 of Project 2025. Respect for life and conscience. CDC must eliminate programs and projects that do not respect human life and conscience rights. It should ensure that it is not promoting abortion as healthcare. It should fund studies into the risks and complications of abortion and ensure that it corrects and does not promote misinformation. Oh, we do not want misinformation or disinformation here. It's interesting throughout this document, the concept of what drives science and what drives research. And there's a number of recommendations about the kinds of research that are necessary. And those are predicated not on science, but on very right-wing ideology. So, for example, we're going to do a research study on how abortion hurts people, how it hurts women, how it hurts babies, how it's bad. We're going to do research on how certain laws regulating occupational safety not hurt individuals, but hurt the companies that are the corporations. So again, not based on science, but definitely based on another worldview. Because liberal states have now become sanctuaries for abortion tourism, Health and Human Services should use every available tool, including the cutting of funds, to ensure every state reports exactly how many abortions take place within its border, and at what gestational age of the child or what reason the mother's state of residence and by what method. So this again, very slippery slope from keeping records on pregnancies, on menstrual cycles, on medications that are used, abortion pills, for example. Yeah.
Also, if they don't report that information, those states will lose their federal funding.
Mm-hmm. Thank you. Yes. There's definitely the carrot and stick approach to Project 2025. Abortion.
Excuse me. Sorry to interrupt, but can't the government switch from federal funding to people funding, if you know what I mean? Get donations from the people.
Great question. And I think we're going to take questions. We're actually nearly done with our presentation. If you can just hold it for a second, but putting on my political science hat, because that's what I used to teach a lot of American government classes, I think you'd be really hard pressed to find any state that could just switch to people funding something and donations. Because as you can see, for example, that leads to deep inequalities. And you can just see that when you look at private school education in some places versus, say, public school education and funding and how that works out. But we can totally tackle that towards the end. But I don't want to stop Beth's flow. Go ahead, Beth.
Well, thank you for that question. This is some of the ideas on gender identity. And when you look at all these circles, on the most left-hand side, we have the blue male, and the most right-hand side, we have the pink female. And gender identity, it can look many ways and comprise a number of different factors. And so this is not, I want to stress this is not a diagram from Project 2025. This is something I added to try and visually show the variations that can be expressed in gender identity. However, Project 25 will not legitimize the unscientific notion that men can become women and vice versa. So very clear again in another section of the document that any kind of transgender work is not acceptable. And here we go to something about woke policies. Now, again, there's no definition of what is a woke policy or what is woke. But the Me Too movement, we do not want any of that. The quota practice should be ended, and NIH office, the National Institute of Health Office of Equity, Diversity, and Inclusion, which pushes such unlawful ideas and actions, should be abolished. NIH has been at the forefront of pushing junk gender science. Instead, it should fund studies into short-term and long-term negative effects of cross-sex interventions, including affirmation, puberty blockers, cross-sex hormones, and surgeries. And so again, science is going to be subverted by the will of Project 2025 in terms of, we're not going to look at evidence, we're going to stack the deck, and we're already going to be looking for bad outcomes. It's quite sobering. The Obama and Biden administrations have really, healthcare policies, and the dramatic increase in Medicaid expenditures is due in large part to the ACA Obamacare, which mandates that states must expand their Medicaid eligibility standards, and that public health emergency, which has prohibited state laws from performing basic eligibility reviews. Basically, what this section of the document is going over is that Medicaid and Medicare are out of control, and we need to be minimizing, privatizing, deregulating any of this, adding work requirements, and match Medicaid benefits to beneficiary needs. This is a suggestion that has come up. I mean, I can think of, hearing the same kind of very conservative perspective for 40 or 50 years, adding work requirements, and here it is again. So, Project 2025 is not just for that 1 year or that one day of the election. It's been developing, it will continue to develop, and as activists and advocates, we can counter some of this when we understand it better. And, very shockingly, eliminate the Head Start program. That is another major recommendation of this document. Yeah, go ahead.
Sorry, quickly to go back is when she noted not only adding work requirements to Medicaid, but I think what's something people might not realize, it also wants to put forth lifetime caps on Medicaid benefits. And that's really concerning for a number of folks. Because if you look at who is on Medicaid and what could happen if you implement lifetime caps, at least it's something like 5% of our nation's population would lose their Medicaid benefits. And that's nearly 95 million Americans. So people will be without. And when you look at the elimination of Head Start, it's not just the elimination of Head Start. Think about Head Start as the elimination of food and services for those children and those families who by and large tend to be families of color, as well as the jobs of the people who work in those Head Start early education programs, which also tend to be women of color and low-income folks who are working in these spaces. But you're going to remove all of that because Project 2025 is not about group childcare in any way. They really think that the woman should stay at home and take care of their child, or someone's grandma has a lot of time and the ability to do that as well. And for a number of reasons, it wants to eliminate essentially Head Start as a place to begin this. But it's really looking, instead of dealing with, we know a child care crisis in the nation. I have 3 kids, instead of trying to deal with this and increasing access and availability of childcare, it's looking to just begin ways to just cut it. But in particular, what's most egregious is to cut it for those who most need it. Right. So yeah, next one.
Thank you. Thank you. This is the life agenda. Eliminate the Health and Human Services Reproductive Healthcare Access Task Force and install a pro-life task force to ensure that all of the department's divisions seek to use their authority to promote the life and health of women and their unborn children. Additionally, Health and Human Services should return to being known as the Department of Life by explicitly rejecting the notion that abortion is healthcare. So again, let's keep reiterating this basic tenet of Project 2025. Restore its mission statement under the strategic plan and elsewhere to include furthering the health and well-being of all Americans from conception to natural death. And if we haven't seen this clearly enough, protect faith-based grant recipients from religious liberty violations that maintain a biblically based, social science reinforced definition of marriage and family. Very chilling. So these are, you've had kind of a bird's eye view of these proposed recommendations, and they're chilling. You know, as I was thinking about doing this today, I said, oh, this is so appropriate. You know, Halloween is coming up, and this is terrifying. You know, seeing this stuff is worse than Freddy Krueger or monsters or anything, because it is so close to real. So instead of getting caught up in our fear or inaction, how do we transform that energy to advocate for change? And we've come up with a few ideas here, and I'm sure that as we have some discussion after this, that there will be some more. Writing to elected officials, sharing your evidence-based personal stories and research, writing to your local newspaper, share the specifics about Project 2025. You know, again, people don't necessarily have the time and space to read all these 922 pages, but to be aware of what's particularly relevant for certain folks and to get them engaged and activated in opposing Project 2025. Create and share your thoughts on social media. This is Chris's favorite. Consider running for a local office. And Chris has a kind of a wonderful way of looking at down ballot positions. And if you want to say a little bit about that, Chris, I think people would enjoy hearing it.
I'm all about being part of this pipeline for change. And we've seen it, but I think sometimes we don't sit down and ruminate about it. And I think I spend too much time in my head thinking, but you can see lots of this everywhere where someone has run and won and serves maybe as your library trustee locally, or they sit on your school committee, or they're on your town select board, or they're a city councilor, and they win. The next thing you know, they are in Congress and they are implementing changes or not, like ending school loans, for example, or, you know, any efforts towards universal health care or any number of other things, but it all started somewhere and we've seen it. So, you know, one person that I am just a huge fangirl of is, for example, Congresswoman Ayanna Pressley. She was a Boston city councilor and now she is in Congress fighting the good fight for families of color, for those who have been historically marginalized, but also just for our middle class and folks everywhere in reproductive rights. And just like Stephen in the chat says, yes, all politics are local. And so that's what I'm saying is obviously we've got to vote in this upcoming election, but it doesn't end there. You know, you need to vote in all of your local elections, in your state elections as well, and literally your city and town, because that's where a lot of ground is being gained for a lot of these issues that are being mentioned in Project 2025. A lot of folks, and one thing I want to mention about Project 2025 is, for example, even though it talks very unfavorably about Anthony Fauci, which you may remember from COVID, who I think is incredible, and the American Public Health Association gave him a presidential citation for his work. What Project 2025, and I don't think we quite laid it out so clearly tonight, but I want to underscore also, is that they want to remove in Project 2025 Anthony Fauci and others who are civil servants, who have the knowledge and experience and education and empathy and compassion to do the work that they're doing, whether it's in the Department of Education or Housing or Defense and other places. But instead, Project 2025 is calling to bolster the president's power, remove these positions as being civil servants, and instead have them be political appointees. And that is very worrisome for a whole host of reasons. In particular, I think I can speak for myself as a public health person, because then you're getting rid of all the evidence-informed and evidence-based research that needs to be done, right? And you're just getting folks who hold a certain respect or adoration for a person. So yeah, so do, support and be a part of your local elections, and also just consider running for office. And if you don't win, and it sounds scary, I know, I've been there before. It is hard to run, in particular locally, because you're really, door knocking amongst your neighbors. But I always say, if you don't run, you can't win. And also, just by running, and even if you don't win, what you've done is you have made the incumbent or the other candidate accountable. They know people are watching, they know what that other folks are thinking and what they want, and they now must do a better job for you. Okay,
Great, brilliant. Thank you, Chris. In case you would like to be in touch with us, here's our email information. And again, as Catherine mentioned earlier, slides, resource guide will be going out to everyone who is registered in the next day or two. I'm going to just stop my sharing here, and we can start a discussion.
Yeah, happy to have a discussion. One thing I will say, and I keep forgetting to do this, is I don't want it to sound like this is something that Mass Peace Action and Chris and Beth just think and are worried about. Because truly, if you look at the research that is done out there across the nation, the vast majority of our nation does not believe or support what is being recommended in Project 2025. Okay. 9 out of 10 people in the US want background checks for gun control. Most Americans want voting rights and access for everyone. Research has shown that 61% of Americans support abortion for whatever reason a person may need it. Climate change, 2/3 of Americans want to prioritize renewable energy. And if you look at all this research, I'm telling you, it's not the rest of the nation wants this. Our problem is, are we telling our local elected officials? Are we running for office? Are we holding them accountable? Are we voting, and are we making it known? Or are we letting a silent, majority just continue to wither away while this loud minority speaks? So yeah, questions. Sorry. I just caught up because this isn't how people feel. Like, people don't want this, right? So yeah.
Thank you both, Beth and Chris. That was, I would like to say that's wonderful, but I'm not going to say that. I'm going to say that's very scary and distressing, but I'm glad that you brought it to our attention. And I've seen a number of good questions in the chat. So Cole, do you have some questions to offer that were presented by participants?
Yes, I have a couple. Actually, there's really only one person who has written several questions in the chat. A couple other people have written some remarks, but in terms of questions, I'll go ahead and ask a couple of Jeffrey Barkville's questions. And meanwhile, I recommend that other people write your questions in the chat so your question can be answered also. So the first question is, how will Project 2025 affect those who are neurodivergent, like me, for example?
So I'm going to be honest and have to defer to Dr. Sommers if you have a better answer, but I don't actually honestly remember it touching upon that. I will say, though, it wants to get rid of the Department of Education. It wants to ban books and research and work that looks at, for example, authors that write about people that are different in any way, any diverse population, whether it's BIPOC, neurodivergent, transgender, I mean, you just name it. And they've already started this at your local level. There is book banning that is happening in every state in our nation that looks at getting rid of books by or for anybody who is different of any sort, really. And so it doesn't tackle, at least I couldn't find it. Feel free to check out those 922 pages. But I know that by what it looks at wanting to eliminate Head Start and its thoughts on the Department of Education, it's not looking to support those who most need support in any way, I will say. And
Yeah. I would think that some of the recommendations related to deregulating and privatizing Medicaid and putting all types of ACA related care at risk would certainly have some impact for communities which are diverse in any way. So, but as Chris was saying, again, there are notable big black holes in Project 2025 where nothing is mentioned, nothing is included in the importance. And sometimes by the absence of something, we see what's the dominant idea. And the dominant idea is that the Project 2025 authors are not considering neurodivergence.
So now I'll put a couple of questions together that Jeffrey asks, and focusing on the question of what kind of struggle can we expect if a conservative president does try to enact Project 2025. So, for example, can fixing the Supreme Court help stop Project 2025? Could Project 2025 lead to nationwide or global civil unrest for those who are against it? So what can we expect if these, in terms of the political or social struggle, if these proposals are tried to be put into effect?
I think people will take to the streets because it's so objectionable. I mean, even if, somebody just has one or two major disagreements with the recommendations of the policy recommendations, that's enough to get people activated and definitely promoting social unrest. Chris, yes.
I feel bad saying this, but tomorrow I'm actually on another panel at Harvard that's free and open to the public if you wanted to do. But it's actually on election anxiety and political anxiety because it is so pervasive throughout our nation and also elsewhere, because like someone had said in the question, what happens here affects other places. So many of the recommendations within Project 2025 have global implications, in particular, if you look at how they want to repeal so many parts of the Inflation Reduction Act that look at our provisions for climate change and renewable energy. So there's just a lot in there and people are really concerned. I don't know how people will act. I wish I could see the future, or maybe I don't, but I don't know. But I will say, with all of this and this awareness, I think, unfortunately, a lot of folks will not realize a lot of what's happening if these come to fruition until the first 100 days or until 2 years into a term that has this. Because all of a sudden people will realize, hey, how is the tax system changing? Because Project 2025 wants to simplify the tax code. It would raise taxes for most working class families, people making under 170,000, for example, but it would actually cut taxes for those in much higher income brackets. Or, for example, someone I think said something about Social Security. If they were able to do what the Project 2025 authors want to do, they would increase the full retirement age. They would want to increase the full retirement age for Social Security, but also cut benefits, Social Security benefits for nearly 3/4 of Americans. And so these are things that you might not see right away, but will be felt, right? And that's what I think is really concerning. And by the time you feel it, it is too late.
Great. Here's a remark from Stephen Davis that I think is worthy for the panel to chew over. He says, remember, the president has been given immunity for any crimes he or she may commit. That includes subverting elections. That means that once Project 2025 points are implemented, they're there indeterminately. Any thoughts about that?
What was the last part of the phrase you said, Cole?
That means that
last
once
sentence.
Project 2025 policy points are implemented, they are there indeterminately. In other words, Stephen is suggesting they couldn't be reversed because elections will no longer be free.
I think that's a dystopic but very possible outcome of all this. I think it will be harder and harder to change. And so the moment to change is now.
Changes now, but also, you know, speaking about my talk about election anxiety tomorrow, I think of this and this work that I'm doing right now with each of you as sort of my own personal version of self-care, right? Is we're working in concert. It's beautiful for me to know that I have great folks like Beth and Cole and Catherine and each of you who are here fighting the good fight together, and that we can commiserate and try again and wake up the next day, right? And we give to causes like this, and with that we know with the research that the vast majority of Americans do not support the recommendations of Project 2025. So then it's really beholden to us to make sure elected officials know that, or that we run for office or we support those candidates to do that. At each part, right? It's not just this presidential election. We have so many that happen. And as you saw in the pandemic, a lot of decisions that truly affect your life happen at the local level. Affordable housing, for example, a lot of that is zoning that happens at your town and city level, made by oftentimes an appointed or an elected board. Books, whether they are in your libraries or not, happen by appointed or elected library trustees. In COVID, schools open or not, and how and what services are provided happen by school committees. These are all local positions. So I am going to stay aggressively optimistic. Someone said to me, now, forever, regardless of what happens at the presidential election, right? Democracy, we have never been a perfect democracy, right? We have never. There was a time in our democracy when women didn't vote, when Black people didn't vote. So it's not perfect, but we can be there to make it better. Sorry.
Okay, great. And here is one from Sharon DeVos. She asks, can you say something about what Project 2025 says about climate change, especially about international cooperation?
Nothing very favorable for acting to prevent climate change, but everything to keep promoting it. In terms of drilling, in terms of more oil and gas, in terms of deregulation, Project 2025 is a delight to the nuclear industry and to the
I think
oil and natural gas industries.
Yeah, it wants to do anything that'll try to lower carbon emissions. It wants to make sure that any grants that are looking at environmental science are, you know, gone and repealed. It supports fossil fuel industries, drilling. So basically, if you think of something that is concerning for you for the environment, and you want to save it, That's not Project 2025. That is not for you. And for global cooperation, unfortunately, because of the recommendations that it gives with regards to the environment and climate change, it's clear that it doesn't care about the effect that we as a nation have on climate change globally, because we know our carbon footprint affects all these other places and spaces that do hardly anything to our carbon footprint, right? And it is silent about that.
Yeah, I think as a follow-up to that, again, it's what Project 2025 doesn't discuss or doesn't take as part of its purview. And even though it's making recommendations that will have global impact, there is no discussion that I found anywhere about our international partners. And that is also troubling. What's there is troubling, and what's not there is not there for reasons.
Great, thank you. I think now I should probably turn it back to Catherine to wrap us up.
Thank you. Thank you for those questions. And I think I'm afraid you've referred to it a few times as a dystopian project. I don't think we have a word evil enough for Project 25 for all that it's going to participate in. And for those of us who have been peace advocates, health advocates, and activists in our community over many years, this just seems like it's the opposite. The coin has been turned around entirely, and we have to turn back and become stronger advocates. And I think that something like this presentation should distress us, but not destroy us. And so that what we have to do is become stronger and unite together to fight this, so that we can, as Chris mentioned, a lot of our policies, the number of people who are pro-abortion, not pro-abortion, but pro-choice, and who are wanting to have good climate change and absolutes, we have to empower those people. And I think that's a lot of our responsibility. So I really thank the two of you for bringing this to us. And the rest of you will be getting the resource page, and that I guess maybe I'm speaking for you two, and maybe I shouldn't, but I think the mandate is we've got to go out and just let people know that this is happening, and let them know that it's going to be such a negative aspect on everybody's lives and people's children and their grandchildren. And this is, if this gets enacted, and it will be enacted. And we've had a lot in the last year. If we just look at what's happened around the abortion issue, it really goes to see it enforces the idea of local aspects of politics and how it can expand. So again, I thank the two of you for being with us this evening. And I thank all of you for attending, and look forward to our next presentation. Thank you.
Thank you, Catherine.
Thank you.
Thanks, Mass Peace Action.
Thank you so much for the action. And of course, thank you, Dr.